Hello and welcome to another podcast of 1 Minute MRCP by Dr. Raza. Today we'll talk about gonorrhea, that is the second most common cause of sexually transmitted infection in the United Kingdom. It is caused by a gram-negative intracellular aerobic diplococci named Neisseria gonorrhoeae. Transmission is sexual, that can be either oral or genital. Anal and perinatal routes are common as well. Incubation period is around 2 to 5 days. Having multiple sexual partners in the recent months or a known partner with gonorrhea, drug use, prior sexually transmitted infections, and men having sex with men are the common risk factors. It is symptomatic in around 90 to 95% of males, whereas women are symptomatic in only 50% of the cases. Urethral discharge, dysuria, epididymitis, and prostatitis are common in males, whereas cervicitis, pelvic inflammatory disease, Fitz-Hugh-Curtis syndrome are common in the females. Metagenous spread leads to mucosal infection. There can be arthritis dermatitis syndrome that is characterized by asymmetric migratory polyarthralgia, tenosynovitis, and dermatitis. Purulent gonococcal arthritis without skin lesions is another common manifestation of gonorrhea. It is diagnosed with the help of nucleic acid amplification test. All individuals that are diagnosed by NAT, so culture susceptibility testing, should be done prior to treatment. There is an increased risk of HIV infection in the patients having gonorrhea, so they must be tested for HIV. Urethral strictures, epididymitis, and salpingitis leading to infertility are the common complications. It is one of the most common cause of septic arthritis in young adults. Ceftriaxone 1 gram intramuscularly is the first-line empirical treatment. Ceftriaxone and cefixime are also considered in penicillin allergic patients. Single dose of cefixime 400 mg orally and azithromycin 2 grams is another recommended treatment option. How to do the test of cure? So if the patient is symptomatic, the culture is performed 72 hours after completion of therapy, and if asymptomatic, NAT is performed 14 days after completion of therapy, followed by the culture if NAT is positive. Sexual partners are treated simultaneously to avoid reinfections. Partner notification is extremely important, and in male patients with symptomatic urethral infection, all partners in the last 2 weeks are to be notified. And if the last partner is more than 2 weeks ago, then she should be notified as well. Patients with infection at other sites or asymptomatic infection, in these cases, all the partners in the last 3 months should be notified. Which partner is to be treated? So, if there is a partner within 14 days of exposure, it should be treated. If there is exposure of more than 14 days, then the treatment is only recommended if the test is positive in the notified partner.